Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier and happier lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thank you for joining us. Today on Community Health Heroes, we'll be talking with Diane Lyons of Festigals and Tammy Swindle, Executive Director of CAGNO, who will talk about Festigals events, including the Bodacious Bras for a Cause Luncheon on June 13th, which will benefit CAGNO. Dr. Ryan Pasternak, Associate Professor of LSU School of Medicine, who will discuss the importance of school-based health centers, and Chef Octavio Icaza of Booty Street Food, who will prepare a nutritious and delicious Eat Fit NOLA version of ceviche, and also share tips for preparing seafood you might have in your freezer, now that we're in the hurricane season. So don't go away, we'll be right back with more Community Health Heroes.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
Welcome back to Community Health Heroes. Festigals, a New Orleans-style empowerment event for women across town and across the country, will take place June 11th through the 14th and will connect, educate, and inspire women through a variety of exciting seminars and events. Here to tell us more is Diane Lyons, founder of Festigals, and Tammy Swindle, Executive Director of CAGNO. Welcome to the show, ladies.
Thank you.
So can you tell me about Bodacious Bras for a Cause and Festigals?
Oh, sure, I'd be happy to. 5 years ago, I decided that we needed to celebrate women in many different ways and bring women back to downtown New Orleans. So we created Festigals, a nonprofit fun weekend that also connects women, bonds with women, causes us to socialize a lot. And we have different parts. We have 24 actual events during Festigals. So one of those events is the Bodacious Bras for a Cause, which is sort of a community give back, because we know women like to have fun together, they like to network, they like to learn and be inspired by powerful speakers, but this is our give back. And it's not just about breast cancer, it's about all women's cancers. And we have women create different types of bras, and this year we started the Bodacious Bras Challenge, which is just a crazy idea that actually worked. I've done many walks in my life for different funds, and you send notes to your friends and you ask them to fund your walk. And so I thought, why can't we do that with bras and have as much as New Orleanian women and community women, actually all the way to Baton Rouge and Lafayette, like to use glitter and glue and feathers. We love that. So why not create a beautiful decorated bra and then ask your friends to support your cause for your mother, your best friend, your girlfriend from college that maybe had some kind of women's cancer. So it's not just about breast cancer, it's about women's cancer. And then we partnered with CAGNO, Cancer Association of Greater New Orleans, and 100% of the funds that we raise from this go to Cancer Association of Greater New Orleans and Brestoration. And CAGNO serves 13 parishes. So as of today, we have 3 top winners. This was a 6-week-long campaign, and we've raised $31,000.
Wow.
Amazing and humbling from the women in the community and the men who stood behind their women and voted with dollars.
So I understand that there's a luncheon coming up on June 13th?
It is. It's a really fun, it's not your traditional ladies' lunch. Of course, because we have Bodacious Bras. We have Festy Guys, a dance troupe that's going to be there this year.
wow.
We have a wonderful speaker from Minneapolis who created a club called the Cancer Club, and it's all about humor. You know, to get through the struggles in life, we have to find the high side, and she's going to bring that to us. We also have Cheryl Delicato, who's furnishing the handcraft wines from California, coming in to talk about her family business. So it's a very inspirational cause, and you can bid on the top 3 bras that have raised the most money, which one of them raised almost $5,000.
And then all that money goes to Cagno.
That's correct.
That's amazing. I also understand you have a program with Ochsner, a very interesting program called Getting to Know Your Girls.
Well, you know, Friday we have an empowerment day that's all about different kinds of business, self-sabotage, how to be a rock star, things that women want to know. Saturday morning we kick it off with a breakfast, and the breakfast is all about getting to take care of your girls, health care for you, and that could be a very uplifting experience, of course.
And then is that program designed from puberty to...
It is, and it's put on
age.
by Dr. Veronica Gillespie, a member of the OBGYN Association, and she is at Baptist Ochsner, which is a women's hospital now.
And then last thing, if I want to know more, our community want to know more, how do we get to know more about Cagno and Festy Gals?
I'm going to let you talk about Cagno.
Well, thank you. Well, Cagno was founded in 1958. We were actually founded to be the local United Way's partner agency to help cancer patients and keep all of the money local. And so since then, we've been helping cancer patients journey through treatment. We usually, when we work with patients, we're helping with prescription medications, nutritional supplements, gas cards, if we have those grants available. And so normally we work off grants. United Way has always been our biggest funder. And then in the last 3 years, Festy Gals came along and they've contributed so much to our women's cancers. Last year we helped over 300 women just with all types of cancers.
Is it for both men and women?
For both men and women. Festy Gals money we're able to keep, and that's what's kind of nice about being local, is when someone raises money for us, we can be specific to what they want. And so with Festy Gals, we keep that money with women in specific parishes or any parishes that we cover.
So if you had somebody that you knew that had a need, they had cancer and they had a need, how would they get in touch with Cagno?
Several different ways. They can go to our website, which is just cagno.org, cagno.org. They can call us 504-733-5539. But the easiest way or best way is at your hospital, go to your oncology social worker. We work with all the hospitals and all the social workers, and they will refer to us. They actually have our applications. They will fill it out as a 2-page application. And then we usually can help with up to about $175 worth of medications, co-pays, money towards bills, whatever they may need, depending on what grant we can use.
Right, but that could be huge for somebody, $175.
Oh, it can be huge. It's just amazing the way, I mean, I can't explain it how, if we're able to help somebody with a wig, someone who, we actually had a lady a few years ago who had not been out of her house in years. Her daughter came to us and all she needed was a wig.
And wigs can be expensive
can be
nowadays.
expensive.
And they just, what we liked about Cagno is it covers 13 parishes, and so it's just not New Orleans. It's Cancer Association of Greater New Orleans, but they help women with babysitting money, gas money. If you live in Covington and you have to go to New Orleans every day for
Crossing that
radiation,
bridge is expensive.
that's a lot of money out of your pocket, and insurance doesn't cover that kind of
Right.
thing. So it's women in the gap, and that's what we liked about it. We also are giving part of our funds this year to Breastoration, which restores women's breasts, which is also managed by Cagno.
Awesome. And how about Festy Gals? If our community wanted to find out how do I come to this luncheon,
Oh my
where
gosh,
would you
the Festy
go?
Gals is, like I said, 24 events. It starts next Thursday evening. We have Irma Thomas as our grand diva of Festy Gals. We always choose a legendary woman. That's Thursday night, and then Friday all day we have Empowering Series. Saturday is the Celebrate You Day, and Sunday is what we call Hangover Hospital with a brunch at Muriel's. So it's a fully packed weekend, and you go to festigals.org, Festy Gals, and everything is there. And our phone number is there if you don't want to do it on the internet. We can take your call.
Well, thank you both for coming to the show today and giving us this very fun and valuable information.
Thank you so
Thank
much.
you so much.
When we come back, we'll be speaking with Dr. Ryan Pasternak about school-based health centers and what they're doing to keep our kids healthy. So don't go away, there's more Community Health Heroes.
This song was created with heartbeats of children in need. Find out how it can help frontline health workers bring hope to millions of children at everybeatmatters.org.
Welcome back to Community Health Heroes. Did you know that there are approximately 65 school-based health centers in 28 parishes in Louisiana, serving 95 public schools and providing access to nearly 66,000 students? Joining us today to discuss the importance of school-based health centers and keeping our kids healthy is Dr. Ryan Pasternak, Associate Professor of Clinical Pediatrics at LSU School of Medicine. Welcome to the show, Dr. Pasternak.
Thank you very much for having me, Dr. Walker.
So tell me about these school-based community health centers.
Yeah, so there's over 65 designated school-based health centers in Louisiana, and then on top of that, there's several community health centers that are placed at schools and are able to see the school population. School-based health centers really function as a pediatric office in a school. They have registered nurses, nurse practitioners, part-time physicians, and then on top of that, one of the most needed things, we have behavioral health specialists, social workers, or licensed professional counselors at these clinics. And they are a resource to the students at that school and sometimes some of the surrounding schools in different areas. And they help kids stay in school and parents stay at home or work.
So what kind of services specifically, like immunizations, medications, what services do these community centers provide?
Great question. So all of those things, immunizations and your general preventive health care, wellness visits and sports physicals, as well as some specialized care. Most school-based health centers in Louisiana are in middle or high schools focusing on the adolescent population, with a few in elementary schools as well. But that adolescent population is known to not get out to see their physicians as often as they need to, and miss some of those other preventive care visits as well as some of those specialized visits that they need.
So like if you notice like a child did not have like the 11-year, 12-year immunizations, would you reach out to the kids or the parents, or how does that work?
Yeah, so both. The schools oftentimes have a responsibility to make sure that their student population is up to date in their immunizations. So they oftentimes will work with the school-based health center and ensure that those students get up to date, whether it's engaging the parents, the students, or both.
So you said you're in lots and lots of schools. What parishes do you serve?
So personally, with LSU Pediatrics, we have 3 school-based health centers in Orleans Parish. LSU Interim Hospital has a clinic on the West Bank of New Orleans at Landry Walker that they're partnering with some other entities for. But a number of different sponsors working across the state of Louisiana really foster these school-based health centers.
And since they're in the school system, what do they do during the summer? Are they open, or there's access to care during the summer?
Good question. That varies a little bit. Our
Okay.
3 school-based health centers here at Eleanor McMain, McDonough number 35, and New Orleans Charter Science and Math stay open year-round. Many of the surrounding school-based health centers in Jefferson Parish, where there's a number of really excellent school-based health centers, they do close for the summer, and then across the state there's a little bit of variation there.
Okay. And then I have another question. Are you seeing this improve the people's health, the children's health?
We are. So the access is the key thing, right? So getting kids into care that maybe even don't know that they need care is really important. Some of the chronic diseases that we deal with on a regular basis include asthma and diabetes. Many of those kids are not going in to get their regular visits and get control of those really dangerous chronic medical conditions. And then the behavioral health component. And so we've seen through an impact study done by the Louisiana Public Health Institute, some of the other work done by partners including Access Health, that these school-based health centers are really having an impact on their populations. And as we grow the number of school-based health centers or the number of students that have access to them, we're able to have more and more impact.
And I can imagine it's very difficult to get your child to the doctors when both parents are working and the kids in school, and so I could totally see how this could provide definite
It's hard for
benefits.
me and my wife to do that for our son on a regular basis, and so for many of our parents and many of our students that are actually traveling a fairly long distance to get to school, it's very difficult to organize that transportation. So that's one of the key things that school-based health centers allow, is to keep everything in one place, get everybody the care that they need, and keep, like I said, parents at home or at work and kids at school.
And if you wanted to know where one of these school-based health centers were in our community, how would you find that out?
It's a really good question. So in the greater New Orleans area, I think the Louisiana Public Health Institute website and their School Health Connection program, or the State Office of Public Health website, their Adolescent School Health program, both have lists of school-based health centers and some of the community/school-based health centers in the area.
That's great. Well, thank you so much for being on our show today. I
Thank
really
you so
appreciate
much.
taking the time.
Sure.
And when we return, we'll be in the kitchen with Chef Octavio Icaza of Booty Street Food for another Eat Fit NOLA cooking segment. So don't go away, there's more Community Health Heroes.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 50 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items right there on a restaurant's menu. We make it easy for you to dine at your favorite New Orleans restaurants, guilt-free. Every month, the Community Health Heroes Show shines a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining in their restaurant or any of our other great Eat Fit NOLA restaurants. So don't go away. Community Health Heroes will be right back with our Eat Fit NOLA cooking segment.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards.
Oh, don't. Oh.
It went into Bob and Carol's yard. Oh, no? Okay, here it comes.
Oh, Mom!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you. Search We Can for more ideas on how you and your kids can get healthy together.
Welcome back to Community Health Heroes. Joining us for today's Eat Fit NOLA cooking segment is Chef Octavio of Booty Street Food, who's going to prepare a delicious, healthy version of ceviche. And with hurricane season coming, share some tips for preparing any seafood to clear out of your freezer before that power goes out. Thanks so much for joining us today, Chef.
No problem. Thanks for having me, Dr. Walker.
So tell me about this dish that you're going to prepare today.
Today, we're going to make an Ecuadorian ceviche. And initially, I was born and raised in Ecuador. What makes Ecuadorian ceviche different than what everybody else knows as ceviche is, especially with the shrimp, we actually are going to cook and then chill the shrimp versus letting the citric acids cook, like a Peruvian style ceviche normally would work.
And so tell me about the ingredients that you're going to use.
Okay, it's very simple. It's all very tropical stuff. We're going to use obviously shrimp, and then we have cilantro. We have some white onions. We're going to use these tomatoes. This is some fresh squeezed lime juice I got earlier today, and the same for orange juice. And then, much like in a lot of Cajun cooking, actually, there's an unexpected ingredient with all these other fresh things. In Ecuador, we actually use ketchup, just straight ketchup. It brings a real nice sweetness that complements it's a real, it's sweet and it complements the sweetness of the shrimp, and it goes well together. So yes, we're gonna do the shrimp in there, and I've got the shrimp on ice here. It's shrimp are very delicate. It's a very, very delicate protein. Sushi grade shrimp you want to eat. You can cook up to 122, 25 degrees. Generally, it's recommended that you cook non-sushi grade shrimp to 132. We're going to go up to about 135 or so. And shrimp is good in the sense that it can very readily let you know when it's cooked. I didn't bring a thermometer. You don't need a thermometer per se. So we bring our water to a boil, and it's really important that you have the specific amount of water that you're going to need for your recipe, as that water is going to have a whole lot of shrimp flavor in it after we remove the shrimp, and we're going to take advantage of that flavor in that water to make the ceviche. Oh, cool. So we're going to go ahead and get these shrimp in, and as soon as they are in, I'm going to make sure that they're everywhere and the water is distributed evenly, and we're going to just let it come up to temperature again a little bit and cut off the fire and hold them that way. Shrimp are labeled with numbers, and the numbers on shrimp are the actual number of units of shrimp you'll find in a pound of weight. So the smaller the number, the bigger the shrimp, and vice versa. And generally larger shrimp are associated with being more prestigious. But in ceviche, you're going to be eating it with a spoon, and it's actually really awkward to have like a jumbo shrimp on your spoon. You're not going to get any of the tomatoes or any of the other things. So we want to use them smaller, and leave the big shrimp to be featured elsewhere. So it's a shrimp ceviche, and it's got all these other things, but you definitely don't want to overpower or upstage, if you will, the shrimp. So we're got to make sure to cut our veggies small enough that the shrimp are still the main feature in the dish. So I give it 3 fork cuts which gives me about 5 strips per half of tomato. And then you have to make sure that you cut it, like I was saying, so that it's there, and it feels like a tomato, it looks like a tomato, but it's definitely a smaller tomato than the shrimp. So there we are. We've got the tomato, and we're going to add it to our little tomato pile. And the onion, we'll do what is called, we feather it. And there's a really neat thing that we do in Ecuador. If you want to, your finger's going to smell a little bit. If you want to grab it and touch it, you'll see that it's soft.
It is.
As if it has been cooked, but it hasn't seen any heat, actually. What we do is...
Kind of curly.
You add the tiniest amount of salt to the onion after you feather it, and the salt will draw the water that's in the cell walls. It'll draw it through the cell walls, so it'll break the cell walls. It makes them soft. It gives it that cooked texture that a lot of people are more comfortable with versus the raw onion texture. But it still has the cool onion, fresh raw onion flavor.
How long does the salt have to sit to make it soft like that?
About 3 minutes. It's
Okay.
impressive how quickly that sort of stuff works. So I was saying we're gonna feather the onions. So you want to cut your onion in half, and then say you want to follow the rainbow. So there's that natural arc, in the onion. And if you angle your blade ever so slightly and start that way, and then as you come up towards the center, you slowly and gradually become perpendicular to the cutting board, and that way you've got feathered onions in the center as well as at the beginning, and then you keep them very uniform, which is important for when you're cooking them or doing anything with them. You want them to be uniform. You don't want, like I said,
The big hunks.
as much as you may like an onion, you don't
Right,
want that.
it's too big.
When you're, it's also bigger than a shrimp.
That's true.
So you definitely don't want to do it that way. Let's get these off to the side right here. We've got all of our onions already salted up and done over here. And then, I brought an orange, but everybody knows, you just cut it in half, squeeze it. We've got our juice. And then what we want to do is cut our lime, and we use it as a garnish at the restaurant. There is going to be lime juice in the ceviche already, but sometimes, some people's personal preference is definitely for more lime or more punch. And, it's a lot of citric acid and clean protein from the seafood, so it's got a lot of headache curing, hangover curing properties.
Great for
people
New
like to say. So here we go. We've got our ice bath, and we've got another container. And what we're going to do is take the shrimp and reserve the liquid from the shrimp in this container. And we're going to go ahead and do that.
So can you tell me a little bit about the concept of the bougie street food?
Sure. It's it's one of those things that when you see somebody else do it, I at least thought, man, that should have been my idea. It's a really, really neat thing the guys have going. We're a street food restaurant that was started by non-restaurateurs. So Nick and Kevin actually used to be travel writers, and they literally used to live the concept that is the restaurant. They used to travel, they were always abroad, and they were, foodies at heart, I suppose. So they were always trying different foods. And it just kind of occurred to them that it sure would be nice to have all of these different foods they were seeing everywhere in one place. And then more specifically, in a nice air-conditioned place where you can get a nice cocktail to go along with, your tacos or your ceviche or whatever it is you're having. So just kind of based out of that, the idea was born. The guys had been in New Orleans before, they really liked it, and it's a good spot. A lot of people come through here anyway, the Spanish, the French, the Italian, everybody's been through, left a little bit of their culture in there, and another thing that, we used to have a lot of pirates and such, and the pirates would always go somewhere, find whatever they deemed the best thing they could, and bring that back. And so under that guise, we have bougie street food, where ideally we bring back the best street foods and serve them to you in a nice air-conditioned room.
So, Chef, it's hurricane season right now, and a lot of times we're left with a bunch of seafood in our freezer. Can you give me a couple recipe ideas on what you can do with that?
Sure. Which you want to be, you want to be careful about how you're defrosting it. So, the best thing to do is to put it in water or running water. I prefer running water. I know it seems a little more wasteful, but it's safer for the fish. The FDA actually just tells you to put it in water and then swap out the ice water after like 20 minutes or so. But if you're looking to do it healthily or with few with as little tools as possible, then steaming always works well. People are always afraid that steaming doesn't really impart a lot of flavor, which is true.
So I heard that there might be a new restaurant opening.
We just opened a new restaurant on Saturday. Actually, was our grand opening to the general public, and it's Booties has done well, and we like what we're doing there, and it seems to be well received. So what we've done is stuck to the international aspect of the restaurant. But the restaurant is called Ursa Major, and so it is very much tied to the Zodiac. And so we do, stuff like this and the fish taco and everything I was saying. But one of the things that we do, which nobody really even bothers with, is we're doing dessert. And I thought I had some healthy dishes and they weren't, so I didn't even try to go with the dessert. But I'm friends with these girls, and they have a company called Girls Gone Vegan. And they do not only vegan desserts, they're also gluten-free, and they fit the Eat Fit NOLA criteria, which is really cool. So leaving it to the experts, I've taken some of their dessert items and we're just gonna feature them on the Booties menu.
That's awesome.
So
this looks gorgeous.
There it is. The popcorn's on the table, and that kind of always happens anyway, so I've stopped trying to fight it. But
well, thank you so much for being here today and providing these incredible ideas on what to do with our seafood.
No problem. Thank you for having me, Dr. Walker.
Join us next time for another great Eat Fit NOLA cooking segment. Don't go away. We'll be right back with more Community Health Heroes.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need, weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at www.communityhealthheroes.org. We hope that the information we provide today will help you and your family live healthier and happier and longer lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.